Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Creatinine clearance rate. Okay, in the creatinine clearance rate, the volume of plasma in the creatinine clearance rate, the volume of plasma that is cleared of creatinine per unit time is calculated. The volume of plasma that is cleared of creatinine per unit time is the creatinine clearance rate. It is approximately equal to that of GFR. So GFR, it is approximately equal to that of GFR, this creatinine clearance rate. Now, creatinine clearance rate is actually measured from plasma and creatinine excretion rates for a defined period of time. It is helpful for estimating the GFR. There are two formulas which can be used for the estimation of kidney function with the help of creatinine. So kidney function, for estimation of kidney function, for estimation of the kidney function with the help of creatinine, we have two formulas are present. For estimation of the kidney function with the help of creatinine, two formulas are present. Like for example, we have a Cockcroft Galt formula is present, and there is also MDRD formula. In Cockcroft Galt formula and MDRD formula is present. So, according to the Cockcroft-Gault formula, creatinine clearance equals to 140 minus age into lean body weight by serum creatinine in milligram per deciliter into 72, and we will multiply all this with 0.85 if it is a female. And according to MDRD formula, in MDRD formula, uh, estimated GFR is equal to 186.3 into serum creatinine to the power of minus 1.154 into age to the power of minus 0.203, and if you multiply all this with 0.742 in females, then you get the estimated GFR value.
thank you and thank you for watching.